Okay. Hi, good afternoon, ladies and gentlemen, and thank you to the organizer of the symposium for inviting me to discuss a little bit with all of you about like the challenges and the remaining challenges for preventing malaria elimination when we focusing on the surveillance system. So what I will be like talking about, it's mainly like rethinking a little bit about what we mean by ideal surveillance system for malaria elimination. What are the criteria? How like the system looks like? And then I will like deep dive a little bit with some of the work that we have been doing at the Clinton Health Access Initiative around like a surveillance landscaping, so working with different countries to look at the surveillance system and how that compare with an ideal surveillance system for malaria elimination. And then out of that, actually, we came up with a couple of like challenges and recommendations moving forward. So first, about like why surveillance is important when we talk about malaria elimination. And if you look at that map of Swaziland in 2012, so it's like passively like reported cases, and you can see like the information being aggregated at some administrative level with a case count, and that's important and helpful. You can see like really areas in the center of the country where you have like a lot of more cases, areas as well more in the east of the country where you have also like a lot of cases. So it's helpful to make like basic support decision. However, when you think about actually what should I be doing exactly in those different like areas, where exactly within that administrative unit should I go like to target my intervention? Such a map might not be exactly like what you need to make like the best and targeted decision. So when you see about like surveillance, what it is at the end of the day, surveillance system, I mean, it's really like a loop. I mean, you can see that from like the point of having like first collecting like the data in the field or in the facilities. Then this information like really will be reported into some kind of system. That information will serve a purpose in the sense of like analyzing, looking at that information, and eventually, I mean, the main point, and like following what Richard was like talking about, it's really like this response and action piece. So based on this information, how you can perform a better response. So that's really like a loop, and that response obviously should have an impact on your number of cases and getting closer to elimination. So when you think about like data collection, what it looks like in terms of ideally, I mean, it's really having like a source of information, both like from the community, but also from the private and public facilities. But it's not only like about like going to different places. It's really like what type of information is necessary. So looking at epidemiology, diagnosis, information about the vector, and how all this type of information put together might inform like your strategy. So when you see, for example, about like collecting better data, I mean, that's keeping like this example of Swaziland. Well, you could see in the earlier year in the period like 2005, 2006, I mean, there were about like 8,000 cases being reporting in Swaziland. What does that mean though exactly, those like 8,000 cases? When you see the little like bar in green is actually like the proportion of cases that were confirmed cases. And then at one point, when you look at the little like green line is actually like the proportion of like the confirmatory rate. And that as goes up, you see like your number of reported cases decreasing, but that's only because actually most of the cases in the earlier years were just like not malaria. So that really like outlines the importance of having like a good like diagnostic and this information being collected and reported. So thinking about reporting, I mean, a couple of things that are important in an animation setting, having like a case-based system, which provide like timely information, but also thinking about the information system like being accessible across like different like levels, having indicators which can be linked together and not like being seen in isolation, and having this possibility of, at the end of the day, being able like to visualize the data. So once this information is being reported, I mean, what do you do with that? So that's really like the analysis phase, and there are like a couple of things to consider, but really like descriptive feature about like, I mean, where are your cases, who is affected in time. But that information, it's not only like descriptive, it should like really like support like your response. So how you can like digest that information like further to be able like to target your response, thinking about like stratification or being able like to prioritize some of the work. So when you look now like back again and coming back to this example of like Swaziland, I mean, you go from like your map of aggregated cases to now you have actually like in Swaziland every cases which are being investigated. So there are like geocoordinates being taken, then the people are being like classified as local or imported cases. And what that information gives you now with like a stronger surveillance system is actually first you can see that exactly where the cases are, and there might not be like in all the administrative unit where you thought there was like more malaria. But not only that, now if you look at like that map with like some cases which are local versus imported, so in blue you see like your local cases. And what does that show you is that in some places actually you have like more local than imported. On the other hand, when you see like this kind of like in the center of the country, this like pocket of red dot and red cases, what does that mean? It's many like imported cases. So obviously, depending on your information, your response will be different. You might not want like, you might not need, and you shouldn't actually do strategy like IRS or reducing like vector in places where all the cases are imported. You just want to make sure you've got a good surveillance system and people can have access to treatment. In the places and when you still have like local transmission, then you want to be more aggressive in terms of reducing the receptivity of the place. So anyway, that's really like showing how like the information like can be used for better decision. And then in terms of like the response, it's really like thinking about making sure everybody can have access to the information, but also being able like to see well what type of response is needed. And that's how they really like use it in terms of in Swaziland, using really like the data that I was just like showing to you, and how that can be translated into some kind of like prioritization of like where they want to do IRS. And that's like the map that you can see with different color for different targeted area. So that's somehow like ideally how like a surveillance system should look like. And we actually work with many countries across like different regions about like looking at ideal surveillance system versus like what is the system that exists. So it was really like a bottom-up approach where we really liaise with like the countries, thinking about how we could help actually improve like the surveillance system, looking at the strengths of the surveillance system, what works well, looking at like the weaknesses and how we can like support it. So we did really an evaluation on a couple of criteria and looking at some guidelines from the CDC, but also WHO about like the surveillance system in elimination setting. So that was really like a bottom-up approach from like the benefit of the country really, and that was done across like different places, but in the GMS, Southern Africa, Mesoamerica, and Hispaniola. So thinking from that at the end, how we can like summarize information, but we really like came up with a couple of indicators, and I don't need to go through all of them, but basically it was like for each of those like section of this surveillance loop, I mean, does the system is case-based? Is there some like community surveillance? Are cases geolocated? In terms of like reporting, do we have an integrated system, or do we have like different like type of system not communicating to each other? What is done with the information, and so on. So we really like through that qualitative landscaping of the surveillance system with the program, it's really like digesting that information into something a little bit like more quantitative somehow. So looking at the results, so the first thing really we looked at a couple of like countries. So what you can see at each row is like each of those indicators that I was just like talking about, and then looking at like the country where they were located somehow within each of those indicators. And here, I mean, you could see like some tendency around like countries where like there were like less like community and active surveillance, places where case classification is not like already done in terms of the collection. And we did that really for each of those categories. So also looking at like reporting, actually, what were like the main gaps in terms of reporting. And one of the main gaps across like the different system, it's really about this integration of the different like surveillance system or electronic reporting. And also we look at, in terms of analysis, what were like the main gap, and most of the country have like descriptive output of the cases, but how that information is being used is really like varying across like the different like countries and region. So really like working with that analysis and the landscaping, we came up with a couple of recommendation and identifying like a couple of challenging as well. So they really like summarize now, but the idea, I mean, one of like the main thing across like most of the country is really like to ensure that like most of like the remote places are being like captured through like a good case management and surveillance. I mean, there are still like many places where there is like no community health worker or people don't have access to facility. So one of the main like recommendation was like really like to extend case management, extend like surveillance toward like those places. And what does that mean? I mean, it might mean like for places to have like community health worker in those regions. That might mean as well really working more with the private sector. And that will obviously like depend on the different like country and situation context. So another example, I stole that slide from our colleagues at Moru, but that was really when they, it's about like malaria post, and they did set up like malaria post along the border between like Thai and Myanmar on the Myanmar side. And what it shows actually like to expand that case management and surveillance closer to the community, I mean, it resulted in a decrease in incidence of falciparum in those places. But what does that mean? I mean, extending like case management closer to the community, you still want and you need like to ensure that information in reporting. So that's really when you like try to think about like what is like the best way to report it. So you might use like paper form, and people might be used to that, and there is like a good system. I think what is like key when you extend the case management closer to the community is having really like simple electronic forms. So I just cited a few of them, but not doing like any advertisement for any of them, but working with like people like PSI, for example, they developed like this app, which is like was like quite user friendly to be, and they were like rolling it out in Cambodia among like the private sector, so where people can really like see, and it's very like graphic, who is infected, whether the people have been tested. So really the importance of like user friendliness of the tool in the field. In Zimbabwe, and Dr. Mberi will talk more about it, but they roll out like the HAS2 tracker and an Android app to really like support in the field the collection of the information during case investigation. Then really like the second like challenge and recommendation, I mean, one of the main things that we could notice is that you have like different like system, but they're not like always integrated, but they might be like very parallel and nearly like collecting like the same information. So how like to design and develop that architecture that can integrate those like different point of entry and information. So that means like different things depending on the context as well, but it might be like developing like data warehouse, being able like to find the common indicators between like the different system. So looking at the example of Cambodia, I mean, in Cambodia you have like a surveillance system where like the collection happens at the field level from different groups, so health facility, village malaria worker, and as well as some like private provider. And that information will flow like through like the peripheral level, but also like the central level. So like the colleagues of Cambodia, I mean, looking at the system, there were like two parallel systems, one which was like really within like the HIS and one within like the MIS. And so with like a couple of like challenges that were outlined. So like when the malaria program like working on surveillance, what they decided actually is like to move from a system which might look a bit like duplicative to a system where like the information is going to be streamlined. And so what the program is like doing right now, it's really like developing a new like MIS system where actually they redesign like the flow of the information and where it's collected from all the different like level. So it's really like from having this information from all those like three like type of providers at the health facility level, village malaria worker, like the private provider, flowing into like a MIS, and that malaria information system will like being able like to inform both the central level, but also like provide like a loop back to the local level. And obviously, I mean, the point of all this information, it's really like to be able to trigger like some action. So that's really like what the malaria program in Cambodia is like working towards in terms of like reporting and streaming like the surveillance. Something when we think about like different like system, it's also like being able like to find a common indicator between the different like data which are being collected. So it's what can be that common indicator. I mean, especially you might use at some administrative level, village or even house. So here I just like wanted like to think about like some methodology. So using like satellite data, for example, to be able like to enumerate like household, how that can be used as a link for different like data. So you can imagine having like your household like enumerated, being able like to collect information about like your cases in the household and linking that with some intervention as well. So thinking like through it and this like availability of satellite images to be able to better link your data together. And we've been working with OSM or other group actually to be able to do that. And then thinking about not only like the reporting of like the collection, but where does that information sit? So again, not really like advertising any system, but we've been working with DHIS2, or there are like DDMS platforms, there are like customized like platform in a country. I think what is important is like being able to have like a data warehouse where like the data are being like stored, like protected, and then accessible at different level. So beyond reporting only, I mean, I think something that has come across as well in terms of like challenge and better recommendation, it's about like the use of data. I think a lot of data is collected, but how it's being used like for the response, it's really like another question. So really the importance of defining like core data analysis and how that will use like to decide when to respond. And that means like going through like having automated like simple output, like having like a decision like support as well. And so I wanted to provide like some example of like some work that have been done like by a colleague from UCSF around it. So they really like look at some information. So on the top, what you can see is the map of risk of malaria in Swaziland, and overlaying it with like the cluster of the different houses that were enumerated, to be able at the end to see, well, what are like the clusters that actually like are more at risk, and working in the offer like a platform, a technological platform, to actually like link those like different data together, to be able like to provide like more support to the program in terms of like better like planning some of the community intervention. And here it was like the case of IRS. Another example, less about like the planning, but more about like the monitoring of intervention, like towards the response. And that's an example of Namibia. So in Namibia, they are doing like the IRS campaign actually as we talk. And so they develop like a simple like ODK form to be able to collect the information. And that ODK form is linked with a platform, with a dashboard, which has been like developed by ONA, which really like be able to see like in real time actually while information being collected, it goes into that dashboard. The dashboard can be accessible, and then people can see, well, are we like performing well? Are there like any issue? How we can like correct those issues? And that can be like in terms of like table, but obviously like maps, etc. And you can have like different interfaces. And so, I mean, coming like to the end a bit, but I think here we outline like a couple of like recommendations. So we're thinking about the importance of extending your outreach for case management, reporting, making sure your information can flow like in a system which integrates different data sources, and the data being used for response. I think there's like one thing which is like cross-cutting across like those different recommendations, which is like really like the importance of building like the capacity within the program, and here actually about like what is really necessary in terms of like user requirement. So I think something which is like really important beyond just like the development of like technology, it's really like here actually what do you need and what for, which is like the main point of surveillance, and what that's being defined, how actually like the training of the people, building like the local capacity of it. And so really like to finish a couple of things I thought like to keep in mind, but among like the different like work we've been doing, liaising with different like people in terms of like technology, I mean the importance of being able to have some kind of like data collection in the field where you could like especially like interact with your fixture. So if you imagine like being in the field, wanted like to collect information, the idea of like clicking on a house, clicking on a fixture, adding information to it, I think that's something like moving forward, which would be important. And being able to visualize that data into like a dashboard, but would integrate not only like epidemiological information, but like information across different type of sources. And then a couple of things that I just like wanted like to cite, just like to keep in mind. But really, I think somehow like the thing which might be like the most important sometimes. It's just like little things might make like a big difference in terms of the quality of the program. So thinking about like simplifying a data form, always like rethinking like why do we need that information for. And I think, I mean, one of the main thing is really like remaining like engaged with the program, actually about like what is needed to start with. So on that, thank you very much for your attention.
Thank you, Arnaud. I think what we'd like to do now is, if there are one or two questions of clarification, we can take them now, and then we will move to the next presentation and allow ourselves some extra time at the end of this symposium for a wider ranging discussion around all the issues of surveillance in the move towards elimination. But for the moment, are there any particular questions of clarification or quick questions for Arnaud?